My name is Dr. Monica Scheibmeir, and my position is Dean for the School of Nursing. And I started my employment at Washburn University in 2000. And I actually think I landed here because of a Washburn graduate that I used to work with, who I had a tremendous amount of respect for, and that's Dr. Ginger Breedlove. In fact, she was one of the alumni fellows for the School of Nursing. And she's this amazing nurse midwife that I had had the privilege of working with as a nurse educator for the span of about 4 to 5 years. And it was a hallway conversation where Dr. Breedlove said, hey, the deanship is open at Washburn and you really need to look at it. And at that particular time, a grant was getting completed and I was feeling pretty overwhelmed and trying to get stuff done. And I didn't think much of it, but she kept pestering me and saying, in a very kind way, saying, it's just this amazing gym. And what I found was that she was absolutely right. It's an amazing gym. And it's got a tremendous school of nursing, and it's just been sitting underneath my nose for quite some time. I think Washburn has some amazing strengths. One, we have an incredibly committed faculty, and these individuals, these men and women, what sort of really sets them apart is, for the most part, on any given day, what you're really going to see is their passion about teaching coming forth to the students, and that they have the kind of rigor that we need in the program, so that that when a student completes his or her BSN degree, I feel very confident that within a short period of time when they go out to a hospital setting or a long-term care setting or public health or nursing home or home health, that it won't take them very long to get acclimatized to the professional world. The other thing that I think is really wonderful about Washburn is we have some amazing partnerships with the healthcare institutions in this region. The nursing leaders in those institutions are superb. So not only do I have great confidence in the kind of nursing care that's going on in those institutions, but it's a great place for the students to learn. In the Topeka area, we have a very strong medical community. And so again, it's that combination of strong allied health, strong medicine, and strong nursing. For a student who's a nursing student who wants to have an ideal learning environment, there is no better place in the state. And I feel very comfortable saying that about Topeka. But the real gold standard, though, for Washburn is that in 2009 they were awarded the Transatlantic dual degree program. And right now we have 3 students that are actually on winter break, but will be leaving to go back to Northern Ireland, to Belfast, Northern Ireland, in about 2 weeks. And they are studying abroad, and the three students that we sent this first year have gone to the University of Applied Sciences in Savonlinna, Finland, and then to Queen's University in Belfast, Northern Ireland. When they return this summer, and then they will have earned the degree, a Bachelor's of Science degree from Queen's University, and then next December they will graduate with their second Bachelor's in Nursing from Washburn University. So in the span of about 1 or 2 extra semesters, these students are actually acquiring 2 bachelor's degrees. So in a world that, you know, where we like to say think globally and act locally, we're going to have some of the most well-prepared nurses in that area coming out of Washburn. And we're only the second program in the United States in nursing to have that. So we really are on the cutting edge of international baccalaureate work in nursing. We have some major initiatives going on right now. A year ago, we started the Clinical Nurse Leader, which is the newest track in our master's program. And I'm very pleased with how that's moving along. And we'll be interviewing applicants for that for the 3rd year, admission coming up this spring. We have what I would call nothing short of a robust adult and family nurse practitioner program that is master's prepared. But we have put forward a proposal that will be evaluated this spring, summer, and next fall by the university faculty, and then hopefully the Board of Regents, on a doctorate of nursing practice. Because many people who have been monitoring nursing know that in 2015, one of the major nursing organizations has recommended that if you want to be a nurse anesthetist, a nurse midwife, a clinical nurse specialist, or a nurse practitioner, by 2015 you need to be entering a DNP, or a Doctorate of Nursing Practice program. So we've got a wonderful plan laid out for that really enhances our current master's program into the doctoral level. What I really like about that, and I want to give a shout out to the School of Business, they have partnered with us, and we will be the only school in the state of Kansas where we have a strong emphasis on entrepreneurship. So our nurse practitioner graduates will have a real business savvy experience in their graduate program, unlike anything in Kansas. And I'm very proud of that effort by the faculty in both the School of Nursing and the School of Business. What I love about my job, two things. Number one, I love to get to know the students. They are, this will age me, but they're a blast. Actually, there's a couple of graduates just from this December that they were fairly new when I came, and so we really kind of bonded. And because we have this thing in the School of Nursing called the Dean's Council, and I get to meet the students that are elected to represent their class. Every month we have lunch, either pizza or sandwiches, and they are so much fun. So I get to hear, like we talk about playlists and who is Rihanna dating, and and what about Glee? Do we like it or not? And yeah, and what are you watching on Fox, and where do you watch your news, and how funny is the Daily Show, and so the students help me not get old. And for that, I will be eternally grateful. So I have to say, getting to know the students are number one. Second group behind the students that I've really had fun with are the alumni and the emeriti faculty. We had a meeting a couple months ago where we invited our advisory group and all the emeriti faculty. And Sarah, I was just kind of blown away. At one point in the room, I remember thinking, Washburn has this tremendous history. There are some of the best and brightest minds in Kansas sitting in this room from the past 30 to 40, 50 years. So it's been really fun to get to know the men and the women that used to teach here, because they're very passionate about Washburn, and they have really interesting ideas. Give us a call. Get a hold of Mary Allen or Dr. Jamison or myself and make an appointment, and come and see what our facilities are like. Bring all your good questions and your parents, if in fact they're involved with your education, or not, if they aren't, and give us an opportunity to kind of talk to them about how to be successful in college so that they can have the best application to get into a nursing program, because they are competitive, and thousands of students are turned away every year from nursing and who have a real strong interest in the program. But one of the things that helps is to get to know the key people early on, and then to know how to get prepared for some of those rigorous science programs so that you can have a successful application.